Today this is the final class for histology regard to central nervous system. We might have some later on classes on revision classes, but new content today is the last one for this group. And today we are going to cover two topics, which is the neural system. We have the slides on. So these are the two neural tissues that we are going to learn today, and it is kind of like a easy slide to understand, easy slide to identify whenever you are given this during slide identification. So this the spinal cord, if you are going to identify it, it has got two content just like the cerebellum as well. So the spinal cord have got like the gray matter and the white matter. Now the disposition of the gray matter and white matter that you should be focusing on. In the case of the spinal cord, the gray matter is placed in the central in position surrounding a canal, we call them a central canal, and the white matter is surrounding the gray matter which is present. The gray matter has a shape of like a H-shaped structure, has got two limbs, we call them as anterior limb, posterior limb, or anterior horn, posterior horn, and central part we have a foramen, we call them a central canal, which is lined by a epithelial cell, we call them as ependyma. Now the reverse thing happens in case of this cerebellum. In case of the cerebellum, this like white matter placed in the central part, the gray matter present on the outer side or present on the exterior side. So whenever you are going to see that in histological pictures or histological specimen. Now we will start with the spinal cord to identify it. Whenever you are given this particular tissue, spinal cord, which is having expanding like H-shaped structure, which is a central cavity. Now we cannot project the whole of this particular spinal cord in a single section, but rather we will in 10x zoom we will be identifying some section like around the central canal, and the gray matter we will be focusing on, and focusing on the gray matter and the central canal, we should be able to identify this particular spinal cord. Likewise, this particular cerebellum, which has got like some like a convolutions or kind of like bulges and elevations, it has some grooves there. So we will be starting to identify this particular spinal cord and the theory part, and this particular spinal cord, how does it look like, gross structures of the spinal cord, how it should be like identifying it, we already have learned to this. So this is how this spinal cord looks like, has a central canal. Surrounding the central canal we have this particular gray matter, and then we have the white matter. White matters are fibers, tracts, and the gray matters are the cell bodies of the nucleus which is present to it. We have got anterior horn, posterior horn, and in between them we have this particular central part, we call them a central canal. This central canal is lined by a cell, we call them as ependymal cell. So this particular part we will be projecting in this specimen. Whenever you are going to see this particular spinal cord, you cannot see the whole thing, that's likewise we are seeing it. Rather we will be focusing in this particular central canal region, which is very much visible, and surrounding the central canal we will be able to see this particular gray matter surrounding to it, and then we have this particular white matter fibers which is present on the different sides of it surrounding to it. So this particular spinal cord, it looks like this, and it has a central canal. This portion only we will be focusing on, this central canal, and this covering of this particular central canal we call them as ependymal cells, which is having a ciliated columnar kind of cells, which is again cannot be visualized properly in case of this particular 10x zoom, but if you magnify it we will be seeing this particular cilia and this particular like a columnar cells which is present. So whenever you are seeing this particular specimen, we will be focusing in this central canal surrounding this ependyma. This is the thing that we will be focusing on. Once you see this particular slide, in it will be easy to identify. This is what you are going to see, and this particular thing can be given in a exam short note as well. So they ask you to just like draw a gross pictures, like exam short note can be given with the labeled histological picture of spinal cord. Nothing but you have to draw this particular schematic picture like this, what you was showing, that we have the gray matter, central canal, and along with that particular horns, anterior horn, posterior horn. It may have an additional horn, we call them as lateral horn. In this particular region we call them as like a thoracic region and as well as upper lumbar region. So, thoracolumbar region may have an additional horn, we call them as lateral horns, and then we have this particular white matter surrounding to it, which is having the fibers or tracks which is running through it. So, this is a schematic picture of this particular spinal cord. If it is given in the examination, you should be drawing this particular picture and which is properly labeled, and this particular central canal you will line it, and this particular central canal is lined by this particular cell which is known as the ependymal cell. The ependymal cells is kind of like a simple columnar epithelium which is ciliated, or single layer columnar cells which is ciliated. So, this is about the histology of this particular spinal cord, no deep digging into it, just basic thing which you have to identify. The identifying feature is that this central canal surrounded by this ependymal cell which is a simple columnar ciliated epithelium cells, that is it. So, this is should be looking like in a slide pictures like this. Now, coming from this particular spinal cord, we have another tissue to identify which is known as cerebellum. So, which has got two cerebellar hemisphere joined by this particular in between connective tissues, we call them as vermis. The difference of the cerebellum is that we have this particular grey matter which is present on the peripheries or on the margins, the white matter present on the central thing, which is reverse in case of the spinal cord. And in case of this particular spinal cord cerebellum, we have some couple of nucleus, we call them as nucleus fastigious, globosas, emboliformis, dentate. 4 of this particular embedded or deeply embedded nuclei are there. This particular like the cortex of this particular cerebellum is deeply convoluted, and it takes a shape of a lip, we call them as Arbor Vitae, or this particular folding looks like a leaf folding, that is why it look like a leafy appearance, we call them as Arbor Vitae. So, this is how this particular gross things that should be looking like. So, whenever you are going to see this particular histologically this particular cerebellum, it should be looking like this. It has a central grey matter which is this one. So, this is grey white fiber which is you are seeing that this is the white fiber, and this is the grey matter which is present on the margins of the periphery, and this particular grey matter is present with it 3 layers. So, inside out we have 3 layers. So, most inside you see that multiple dots are there, right, it looks like a granular layer. So, that is why you can call them as granular layer, most inside. Most outside layer we call them as molecular layer, which is like a sparsely dotted there, and in between this granular layer and this particular outer molecular layer we have a very thin lying layer of the cells which looks like a vase shaped cells, we call them as Purkinje cells. So, we call them as Purkinje cell layer. So, it has 3 layers and the central grey matter which runs like this, grey matter fibers runs this. So, this is a schematic picture of histology of cerebellum. So, again this is given like last supply exam, a histological picture of the cerebellum with a proper label. So, this is a schematic picture, it should be looks like a leaf like this. So, this particular thing looks like a leaf, this is also a leaf, it has a kind of strand like thing which is running in here which is white matter fiber, and this is having 3 layers, outer one, middle, intermediate, and this is inner one. Inner one is dotted which is surrounding this particular white matter, we call them as granular layer, it looks like a grains, that is why you call them as granular layers. We have got kind of different cells present in it. So, this particular granular layer which is present inside to it which has a particular cells, this cells layer which is looks like a vase which is characteristics of this particular like cerebellum, we call them Purkinje cell layer. This Purkinje cell looks like a vase, flower vase, it looks like a vase, and it has a projections like this. You see that this is Purkinje cell, this tiny one, and it has a string like thing projecting like that, looks like an octopus or looks like a projections, jellyfish kind of projections. This particular projections, cellular projections which is going there, looks like a middle layer, we call them as Purkinje cell layer, and this outer one which is partially dotted like this, we call them as molecular layer. We have got different cells present in these particular layers, in this molecular layer, in this particular Purkinje cell layer, and as well as this particular the granular layer which is present to it. And along with that we have this particular deep fibers which is running to it, which is present. The pathognomic or kind of like hallmark for this is this kind of cells. It looks like a vase, and from there it looks like a tentacle pushing up. This is a Purkinje cell layer. The Purkinje cell is a kind of hallmark for this particular cell layer, we call them as this cerebellum. So, granular layer which is deep inside, then we have the Purkinje layer which is thin layer, and the most outside is this molecular layer. So, this is how it should be looking like, this schematic picture that is showing it, and in reality it is exactly like this you are going to see. So, this is the inner dot layer that you are going to see, and this is the fiber, white matter fiber. This white matter fiber which is going in it, these dots over here, granular layer. Then we have the Purkinje cell layer, this one tiny, this thin layer sparsely present. These are the dots which is present, Purkinje cell, and this whole thing which is known as molecular layer. So, this is a kind of like a histological image of cerebellum, and this is a like a little bit magnified 40x magnification, but in a 10x it should be like less informative look, it will be there. So, this is should be looking like a central gray matter fiber, white matter fiber surrounding that the gray matter have 3 layers, outside to inside we have 3 layers. So, this is a histology of the cerebellum. So, we have the outer gray matter, inner white matter, the gray matter 3 layers, outside to in, molecule, Purkinje, granular layer, that is it. So, it should be looking like this, no deep digging. So, we have 2 slides to each of them, the spinal cord and the histology of the cerebellum, 2 of them. Take 2 pictures, both of them are easy to identify. In case of the spinal cord, we cannot see the entire picture of the spinal cord, only the central canal and the ependyma. We focus the central canal and ependyma, which should be look like a rhomboid shaped structure, and surrounding that we are going to see this particular cerebellum, which has got like inner cell layer which is like white matter, outer cortex, gray matter, 3 layers on it, molecular, then we have this Purkinje, granular, outside to in. Check it out, it is that just like the same as you are seeing it in this particular picture, and there are different cells are there in this particular layers of the cerebellum. Just drop everything, remember this Purkinje cell, rest thing will be taken care of by its own.